I'm hoping you're doing pretty well. I wanted to talk to you about your strategy for making sure that self-care is a priority and you're not blindsided when cold and flu season hits us in a couple of months. Really think about the last couple of years. How have you felt when your workload increased, your patients became more complex, and resources and tempers became more intense and scarce? If you know something hard is coming, do you walk in blindly, or do you try to set yourself up for success? I love to share the SWOT strategy and how you can apply it to planning your success. You figure out what your strengths are, and you figure out what your team or your organization, your unit's strengths are. You figure out what opportunities present themselves. You know that certain days are busier than other days in the clinic. So what can you do on the slower days to prepare for the intense days? And what are your threats? Do you know that absenteeism, call-offs, and workforce shortage are huge threats to the success of your care for your patients? And let's be honest, what are your personal weaknesses? What are the things that just drive you crazy and they take you out of your game of focus and caring? How can you build in cushion and space so you can show up your best when the system is strained in that capacity? Those are the strategies I want to empower with you to control what you can, prepare for what's foreseeable, and still find joy when frustration is all around. There are strategies to get through. It's easier when you have a success squad. They help you see other opportunities that maybe you couldn't see before. So as you think about the goals for climbing the career ladder next year, think about the larger threats that could take you off your game, delay the process, or view it as an opportunity to use your leadership skills to guide your team through what you know may be a challenging time. All right, Lady Doc, take care of yourself.